Okay, I am so happy you're here to join us. Good afternoon and morning to some of you. Thank you for joining us for today's virtual meeting on COVID-19 justice responses for juvenile justice. My name is Ann Teagan, and I manage the juvenile justice portfolio for NCSL, as well as the portfolios on record clearance, reentry, and young adults in the system. And I will be your host today. It's actually really hard to believe that just 61 days ago, a national emergency was declared and our country and our reality changed forever. In response to this new world, NCSL's criminal justice program created a 5-week virtual meeting series to cover different portions of the criminal justice system and how it has been affected by the pandemic. This is the third in the series of meetings that we are hosting, and we hope you join us for our next two as well. There are a number of NCSL staff that specialize in state and federal criminal justice policy. Please call on us at any time. We are here to provide you with assistance so you can be effective leaders in your state. First and foremost, I would like to recognize the Pew Charitable Trusts Public Safety Performance Project. Their generous support has made this meeting possible. But more than that, their support and their partnership with us on criminal and juvenile justice policy issues since 2007 is really what has given us the knowledge, research, and tools to jump into action on this. This virtual meeting is designed to give an overview of how the COVID-19 pandemic is affecting young people in the juvenile justice system and how the system itself is responding to the needs of justice-involved youth and their families in the midst of this emergency. Today, you will receive a brief overview of the issues we're seeing related to COVID-19 by Dana Shoenberg of Pew Charitable Trusts. Then Dana will ask our panelists, Judge Stephen Teske from the Clayton County Juvenile Court in Georgia, and Heidi Mueller, the director of the Illinois Department of Juvenile Justice, about what actions they're taking to ensure the safety and care of justice-involved youth both in and out of facilities. So before we get started, I'd like to cover a couple of logistics. Karen McInnes is managing our controls for the meeting today, and we have everyone on mute to ensure audio quality of the presenters. My colleague Amanda Essex will be adding resources into the chat box, so please be sure to check those. I really encourage you to join me in taking advantage of the chat box function, and you can access the chat box by clicking on the word bubble symbol in the navigation bar. Throughout our meeting, our speakers will be referencing various resources, and Amanda will be dropping those links into the resources into the chat box for you to view. Please definitely also use the chat box to submit questions for the faculty throughout the meeting, and I will collect those questions and have them for the Q&A session at the end. We do have a resources page for this meeting, and on that page you can find the PowerPoint slides and some resources, and after the meeting we will be adding additional resources and a recording of the meeting. Bios for our speakers are also available on that page. Like I said, we've reserved time at the end for questions, so please submit your questions to the chat box, and if we do not have time to address them, we're saving those conversations where we can respond afterwards. So I think most of the logistics are covered, and I am now proud to turn the meeting over to Dana Shoenberg. Dana, the floor is yours.
Thank you, Anne, for this opportunity, and we are so glad that all of you are joining us today. We know from many of you and from your colleagues that in this time of the coronavirus, you've been hearing about the increasing number of kids and staff in juvenile facilities who are testing positive for the coronavirus. You're concerned about possible transmission in community settings. You're worried for youth and staff, for their families and their communities, and you're thinking about what you can do. Our goals today are to update you about the challenges that the coronavirus is raising for juvenile justice systems around the country. We want to highlight some key issues and examples of responses in some states and arm you with some questions that you can raise as you think about both short and longer term measures that your governments may wish to take. So as we move to the next slide, just a couple of reminders about some of the relevant research in this area. As you are well aware, because you've been working on these issues for many years, research says that under normal circumstances, kids who get in trouble with the law generally do better if they've had interventions while living at home in their own communities. In particular, the research shows that incarceration generally doesn't make kids less likely to reoffend. that for kids who don't have major offending backgrounds, being sent to an institution can actually make them more likely to commit a crime when they get out, and that longer lengths of stay in confinement don't produce better outcomes. So on the next slide, we have a graph that shows the findings of the seminal Pathways to Desistance study. And that's a study that looked at kids with serious offense backgrounds in Phoenix and in Philadelphia. And what they found was that keeping kids in confinement for 3 to 6 or up to 12 months doesn't yield a difference in the likelihood that a young person will commit another crime. So there are lots of reasons why normally you might want to keep kids out of placement or have them leave as soon as possible, since incarceration has little benefit for public safety. But now on top of that, there's a contagious virus to consider. So states are building on the foundations of the improvements that many of you have accomplished over the years, backed by the research, and they're figuring out what additional steps they can take to keep kids and staff and families and communities safe. So as we go to the next slide, what's been happening across the country? How are states responding? There's a wide range of responses, as it turns out, from large-scale releases in some states and almost very little happening in others. And so we can talk a little bit first about some of the governors that have issued directives. An example is in Michigan, where Governor Whitmer has strongly encouraged elimination of detention or placement unless a youth poses significant, substantial, and immediate safety risk to others. And she's encouraged elimination of incarceration for probation violations. She's encouraged elimination of in-person probation meetings while it's not safe to do so, and a number of other safety measures in facilities. Governor Newsom in California halted new placement admissions and also eliminated notice requirements so that the releases from facilities could be sped up. And Governor Polis in Colorado granted temporary authority to the Department of Human Services, which doesn't normally get to make its own release decisions, and allowed them to review and release kids instead of having a parole board do it, which might take more time. There are other coronavirus-related changes that have been fueled by litigation, and Maryland is a good example of that. So in Maryland, defenders petitioned for a large-scale release from the court, and they weren't granted that, but in mid-April, the chief judge of the highest court issued guidance that was based on her own emergency powers. And what she did was recognize that some jurisdictions had taken active measures, but some had not. And she ordered judges to work with the other stakeholders in their jurisdictions to identify youth who should be considered for release. She restricted the use of placements to situations that are necessary for public safety. And she told them that they needed to respond expeditiously when the Department of Juvenile Justice or Counsel for Kids asked for hearings to review cases. She laid out a number of factors to consider in those reviews, and now almost a third of the kids in Maryland who were in detention or long-term placement facilities have been released since the start of the virus. Massachusetts is another litigation example where there was litigation on behalf of adults, and it ended up creating a rebuttable presumption in favor of release of people who were charged with most nonviolent offenses and with probation violations. And what the high court did there was to extend that relief to kids who hadn't been part of the litigation. So despite some of these individual measures, most decision-making has actually happened at the local court level and at the state juvenile justice agency with those officials, and with varied outcomes. So some state and county agencies have taken little action to release kids. Meanwhile, Mississippi is an example of a state that took very significant measures early on. So back in mid-March, they reviewed every youth who had been in their secure placement facility for 90 days, and they released about half of the population way back then. You'll hear from Director Mueller soon about her agency's many different courses of action, and in all of those responses combined have resulted in a youth population reduction of about 30%. In many jurisdictions, we're hearing about significant reductions in arrests, and that's helped to fuel a 24% decline in local detention. You'll also hear from Judge Teske, who can tell you about the work he's been doing to push his court far beyond that point in Clayton County, Georgia. One thing we think it's important to keep in mind is that some of the very measures that states are considering taking in this short term for public health reasons are measures that other states have already adopted in their laws on a more permanent basis. So examples like Kansas and Utah, where their legislatures in the last few years have adopted significant measures that more or less permanently keep certain types of kids from ending up in placement facilities at all, that restrict the length of time that kids can stay, that don't allow for kids who are charged with probation violations to end up in secure placement. So there's an opportunity to learn from those states that already have a significant track record on these issues as states consider what to do now in the short and medium term. And Pew has a new web analysis that covers all of that in more detail. So we encourage you to have a look at that. And I'm sure that the link will be in the chat as well as in your materials after this session. As you listen to Judge Teske and Director Mueller, and as you think about where to turn your energies at home, a few areas to keep in mind. We've already talked a little bit about restricted admissions and about expedited releases. Temporary home passes are another way that some jurisdictions have been able to allow kids to return to their families. In order to support kids at home and make sure that they have success when they are there, we need to make sure that there are strong community-based services in place with close collaborations with juvenile justice agencies. They have to be adequately funded and staffed so that they can be the effective and creative partners that agencies need right now. Another area that you could be asking about is about the conditions in facilities in your jurisdictions. So certainly there are all of the range of health and safety precautions we all know about that are important in institutional settings. Do they have enough soap? Are they being taught about distancing measures and how to prevent the virus, the transmission of the virus? We also know that kids in facilities have serious trauma histories. They have significant adverse childhood experiences, and that's under normal circumstances. Now there's a virus adding to the anxiety-provoking nature of being away from their families. And it's important to ask some questions about how facilities are responding to kids' needs in those circumstances. Are they having access to families and other supports through video and phone calls since visitation has generally been suspended? And we know from some examples that actually facilities have been giving kids more access, in some cases unlimited access to video contact with their supporters at home. And the question is that happening everywhere? Worth finding out. And another important area to think about is about the use of solitary. Are jurisdictions doing what they can to avoid the use of solitary, which we know can exacerbate mental health symptoms and also create new mental health concerns? As we move to the next slide, we've got a little bit more here about probation conditions. And so how is your locality, how is your state adjusting probation conditions to be realistic when there aren't jobs for teenagers that might have been mandated, when they can't attend programs that aren't open? And another area to think about is fines and fees, as families lose their jobs and aren't able to pay, in some cases never were. Maine is a notable jurisdiction that actually did something related to fines and fees in the wake of the virus. They vacated all warrants for outstanding fines and fees and restitution. And that's something to be thinking about as well. One more thing to raise is that you know that youth of color are disproportionately represented in the juvenile justice system. It's also becoming clear that communities of color are disproportionately impacted by this virus. So it's important to be vigilant that as we're making adjustments to our juvenile justice systems, that those benefits of things like early release are distributed in ways that are equitable. There's something that we know from research that often the white kids are the ones who get the benefits of discretionary decision making. So how do we make sure when there's an extensive use of discretion right now that kids of color also get the benefits from those opportunities? So I'll leave you with that, and let's turn now to our panelists. We have the Honorable Steve Teske, who is the Chief Presiding Judge of the Juvenile Court in Clayton County. He's been a national leader for improving juvenile courts and juvenile justice systems, and this is a challenging moment in history, which is no exception to his leadership. Director Mueller has overseen Illinois' Department of Juvenile Justice since 2017. She has backgrounds in psychology and law and has directed and been propelling Illinois' juvenile justice system forward through her roles directing private provider programming, the Illinois Juvenile Justice Commission, and now DJJ. So we're honored that they were both able to join us given all the demands to them amidst this pandemic. So I'm going to start with you, Judge Teske, and ask, would you please share some about the background of your court that you oversee, what you've done to respond to the pandemic over the past 2 months, and why you've taken those steps?
Sure, Dana. Clayton County, when you fly into Atlanta, the world's busiest airport, you're in my county. Just to give you a geographical fix and understand what we look like, we're the fifth largest in population among 159 counties in Georgia. So I have juvenile court jurisdiction over delinquency and dependency cases. Regarding the pandemic, the moment that the Chief Justice of our Supreme Court declared a statewide judicial emergency, I entered my own court order regarding the operations during this judicial emergency. And as you can see from the slide, the order first modified the admissions criteria so that we would prohibit the admission of kids that are alleged to have committed nonviolent offenses. I immediately also created an assessment team. It was really about a 3-person team to evaluate those kids who were currently in the detention center, take that new criteria, apply it to all the youth in there, and recommend which ones should be released based upon that criteria. Consequently, a number of youth were released immediately within 24 hours. Now, I then instituted, by way of this court order, weekly status conferences with the youth that remained detained for the purpose of assessing their propensity for violent conduct. And I just want to make a note there that, just because kids commit a delinquent act, and even more specifically a violent act, doesn't necessarily mean that they are indeed delinquent or they are indeed violent by the nature of their adolescent development. But also to reassure them that we continue to review their status. So it's about their psyche. Time restrictions have been suspended. They're not sure when their case is going to come up. And so for those kids who remain detained, I think it's very important that there is consistent contact. So also included in this is going to be their lawyer, the prosecutor, and their parents. So we have that weekly contact. I already had a multidisciplinary team I've been using since 2003. They went virtual. It's a multidisciplinary team who assesses youth that generally are admitted into detention. So when we do have a new case that comes in on the new criteria that's more restrictive, then they meet with the youth and the parents virtually to assess and try to come up with a recommendation to the associate judge who presides over the preliminary hearings as to an appropriate alternative. And then lastly, we continue to hear cases remotely, arraignments and dispositions, but even in matters involving adjudications. I've told the public defenders that I'm amenable to holding an adjudication hearing, provided that the child has been advised of his or her right to confront their accusers, but they can waive it, have a limited waiver, and they're able to confront their accusers by video. So essentially, those are the steps that I've taken.
Well, those are significant ones, and we'll hear a little bit more about those. I want to turn to Director Muller and ask you the same questions. Can you give folks a little bit of background about what you've been overseeing and how you've been responding?
Sure, thank you. I am the director of the Illinois Department of Juvenile Justice, and in that capacity, I oversee 5 secure custodial facilities located throughout the state of Illinois, and then 8 aftercare offices. Aftercare is our juvenile parole division. Essentially, when Governor Pritzker in Illinois declared the state of emergency and we began limiting large group gatherings in the state, my first reaction was, oh my gosh, I don't want to do this. I don't want to navigate a state congregate care system through a global pandemic. But then my next thought was, okay, how do we do it? And really our response has fallen into 4 key buckets. As we looked at how we best keep our kids in custody safe, as we looked at how we keep our staff safe, my 2 main goals were to avoid an outbreak in any of our facilities and to make sure that, quite frankly, I didn't want any of my staff dying. And so the four buckets that we looked at were our operations and what standard operating procedures we needed to put in place or to change in order to ensure that we were following CDC and public health guidelines to keep everyone as safe as possible. Things like screening measures, things like social distancing, new cleaning protocols, just a huge array of different operating procedures to ensure that all the folks coming in were being screened, that we were not allowing this virus to enter our facilities unknowingly, and then ensuring that within the facilities we were doing everything we possibly could to keep people as safe as possible. The second bucket is what I'll call PPE and supply. We immediately assessed what we had in terms of masks, surgical gowns, gloves, all of those sorts of things that we need to keep ourselves safe, cleaning supplies, sanitation supplies, and we immediately began preparing for sort of the long term to make sure we had enough PPE for all of our staff and all of our kids. The third bucket is communications, and that was a huge and critical thing that I think sometimes can get overlooked when you're in a crisis response mode. But we immediately set in place a variety of different communication channels through website, through Facebook. We started posting information. We communicated in writing and via phone call with families about what was going on. We set up a daily briefing with all of our facilities and all of our department heads to convey information, and then we would do that verbally and in writing. And then finally, I think a really important thing we have done is we've involved our kids and our staff in the communications themselves. So we've issued challenges to kids to develop public service flyers and posters and announcements. We set up a talent show for them to talk about social distancing. We did the same thing with staff. We issued a challenge for them to develop their own flyers and to do public service videos, so we got some that were kind of jokey and some that were serious, but we really got all of our team involved in spreading the word about what we were doing. And that has actually proved to be a great team building exercise as well. And then the final, and I think one of the most important things in our response has been what we're calling load management. We are load managing. We're looking at the human traffic coming into our facilities and how we reduce that through limiting intakes, through limiting visitation and volunteers, and even by putting our staff on 14-day rotations so that we can continue to operate and continue to follow through with our basic programmatic function, but ensure that we're limiting traffic and that we have a fresh bench of staff at all times who are able to sub in every 14 days. I think the most important piece of all of this is our population management. We have done, actually the data that you have on your slide is not quite up to date with where we're at. We started on March 1st with 218 youth and we are down to 112 as of today. So it's about 49% of our population. And really, our main goal at the start of this was how do we make our facilities as safe as possible? It was very clear to us that we needed to be able to have standalone units where we could quarantine youth if we needed to, if we had an outbreak. And so we looked at our population and we began looking at where we could expedite releases so that we could get to a place where in all of our facilities we have sufficient capacity and space to be able to quarantine youth if we would have any youth positives. I can't really emphasize enough how important that population load management is in order to respond to both this COVID-19 pandemic, but I think going forward, it's something that all states are probably going to need to think about, because we know that these sorts of things are going to happen going forward again. And I don't know how you survive without the ability to really be able to be nimble and isolate and move your population and separate your population.
Thank you for that, Director Mueller. Maybe I'll stick with you for a minute and just ask you a little bit. So you've taken all of these measures. It's been a couple of months now. It sounds like things have moved in significant ways even in the last few weeks. What impact have all of these measures had on staff and in youth? What are things like in your detention centers now, or in your placement facilities now?
Well, we have been very fortunate. So I will say that we have managed to avoid any outbreaks in any of my 5 facilities. Right now we have no positive cases among staff or youth. We have had cases of staff who have reported a positive COVID-19 test, but we were able to put in place very early on a really aggressive screening protocol. And so in each case, we were fortunate in that the staff who reported a positive test had already screened themselves out of the facility based on either contact with someone else or contact with the positive person or contact with someone who had symptoms. And so as a result, they didn't end up really bringing the virus in. We did have one youth who tested positive as well. Again, because we have such a low census, we were able to immediately isolate him, immediately isolate all of his close contacts, and quarantine all the youth in that facility until we could get test results back, and we were able to avoid having the virus pass on to anyone else. So that's kind of where we're at in terms of virus. In terms of our staffing, I think that it's a totally altered universe, but we are continuing with programming. We are doing a lot of our programming remotely and as creatively as possible. Our staff have really, really stepped up and developed programs for our kids. In one of our facilities, we have the Quarantine magazine that the kids are publishing. We've been doing some entrepreneurial challenges with them, and kids have been developing mini businesses while they're in quarantine. One girl developed an art business and she charges bags of chips and candy bars to anyone who would like a portrait. And we're just trying to really lean into those really creative and innovative responses. I think surprisingly, the morale seems to be pretty good, and I think it's a huge function of what I mentioned earlier, which is involving everyone into this communications process, getting everyone involved in spreading the word, trying to add some humor into, our universal masking and our cleaning and everything that we're doing. And I think also there's a few, I'm assigning, and I myself, folks on the executive team, we are in the facilities. We are present, we are showing up, we are standing there with our staff shoulder to shoulder, and really sort of making sure that they know that we're all in this together.
Wonderful. So Judge Teske, a similar question for you. You oversee your local detention center. So what ways have you made decisions that have led to where the population is now? What does that look like? And what's it like for the kids who are there?
Yeah, so if you look at this at your screen, you see the slide that shows over the weeks since the week before the pandemic, we had like 21 or 22 youth in detention out of a 60-bed facility. So, as you know, Dana has said earlier, I'm one of those jurisdictions that, and in a state that has already codified a number of practices that other places are now moving to temporarily during this pandemic. So even though I have a 60-bed facility, our average daily detention population is 15 during the course of the year. As you can see, with the things that I have put in place that I described earlier, the detention population has declined by 95%. And so right now I have 2 kids that are in there. I think it's been extremely helpful to meet with the kids every Wednesday afternoon. In fact, before coming on to this webinar, I had just finished meeting with those kids and their attorney and parent and the prosecutor. I noticed that there was a question posed about are victims included, and they are included. They're included in that portion that's the multidisciplinary team. It's called the FAST panel, Finding Alternatives for Safety and Treatment. On that multidisciplinary panel is the victim assistance coordinator, who's in constant communication with any victims in a case, and they are able to share, their position, their thoughts to the FAST panel, which is conveyed to the judge. Let's say in the preliminary hearing, The status conferences are not hearings, They are provided under a uniform rule that allows for judges to meet with the attorneys, and the parties for purposes of deciding how to move a case and what's next, and are there things that need to be accomplished before we can get to the next. And so I instituted that for the purpose of making sure that the kids in detention, that remain in detention, that they are reassured that they are not forgotten, because that's extremely important. Keep something in mind, ladies and gentlemen. It's not just simply for the child, but it's for people like Director Mueller and her staff. If I can help keep these kids calm, level-headed, then I'm helping to make things easier for the staff. That means that we're going to reduce the risk of fewer kid-on-kid altercations and kid-on-staff altercations, because you can imagine if you're locked up for an extended period of time and being a kid. So there's a number of ways to look at. It's not just simply getting rid of kids and moving them back home, out of what are really Petri dishes, because the thing is that I know kids in our institutions are not being tested for COVID. They're not going to get tested unless they show signs. And we've only had 1 kid so far that's been symptomatic and was tested and did test positive for COVID-19, So we really don't know how many kids have been infected, And of course, there's another concern that right now is we're hearing from out of New York and some other places regarding the relationship between COVID-19 and this Kawasaki-looking type of thing that's going on with kids, And we've even had some kids pass away. I think up to 3 at least was the last time I heard. And so you got to understand, my father was in infectious diseases. He retired from CDC, and it was some time ago he was telling me over the phone, he said, son, don't be surprised if all of a sudden, this virus mutates and changes, and we find the expansion of the population that it's going to affect, and it could get to younger folks as time goes on. So the sooner we get a vaccine, the better.
Words for the wise. And I think it speaks also to the idea that we shouldn't just be thinking about what folks have already done. And as people think about opening their communities more, we need to also be thinking about what are the possibilities that we may have a second wave, and whether the kinds of measures that jurisdictions have taken already are the full extent to which they should. Maybe there are some that we should keep for the long term. Maybe there's some that still need to be changed. So Director Mueller, let's turn back to you. Your agency is also responsible for aftercare. And I'm curious about the community service side of this system, community supervision. How have you been managing the kids on community supervision, and what can you tell us about what that looks like right now? I think you're on mute.
Sorry. First, I have to give immense credit to my aftercare team. As you can imagine, when we went through this process of expediting releases, and the way we did it was to look at kids who were within 60 to 90 days of their scheduled targeted release date. When we did that, special guest, sorry. When we did that, we started, we moved a lot of kids onto aftercare status, onto community supervision status, and we had to do all of the sorts of things that we ordinarily do, creating staffing plans, approving host sites, making sure that we have everything in place, and we had to do it really quickly, and without the sort of resources that typically would be there. And they did a phenomenal job with that. We ended up sort of looking at aftercare similar to the way we looked at the facilities, and that was with the idea of load management. We knew that we were going to have an influx of kids on aftercare supervision, and so we began at the same time that we were expediting some releases, looking at the kids on aftercare status and looking at any kids who were within 90 days of their already scheduled discharge date to see if we could petition for early discharge. If the kids were doing well, if they were making good progress, if they were compliant, we were able to look at that group of kids and actually release them from aftercare supervision early as well. So that helped our aftercare team manage their caseload. We also had to really rethink how we approached aftercare supervision, and we had to do a lot of partnership with our community partners on that, because all of the things that we ordinarily rely on, school, community groups, camps, all those sorts of things are not happening. So our aftercare team worked with one of our providers, and they developed an app that can be downloaded onto any smartphone or tablet that we pay for, that all of our families can download, and then we can do face-to-face check-ins that way. We started doing curbside check-ins with some of our high-risk kids. So kids who need a face-to-face, who need us to actually check and make sure that they are cared for and where they're supposed to be. We maintain social distance and do curbside check-ins. We do window checks where we peer in the window and make sure everything looks okay. And interestingly, throughout this process, we've actually seen our number of contacts increase. It's greater now than it was pre-COVID-19. And I think part of that is because we've greatly expanded the ways that our aftercare specialists can contact and communicate with families and kids. But I also think that a lot of our staff are trying to pick up the slack where schools and some community providers are just not able to sort of fill in the gaps here. Some of our providers have been able to similarly develop remote mentoring, and we do have some, really courageously compassionate folks in our communities that are continuing to do face-to-face visits and mentoring and wraparound services with our kids as well.
We've been hearing that some jurisdictions are even making sure that families have cell phones to stay in touch with their probation officers. What do you need and not have for your kids right now, Director Mueller?
Well, one of the things that we found we needed and we were able to solve by partnering with our Human Services Department in Illinois was expedited SNAP benefits. So as kids are coming out, especially now with people losing jobs, it does create a extra financial burden on families. And so expediting SNAP benefits helps them a little bit with taking, their young person, having another mouth to feed. I think really what we're seeing though is, kids can't get jobs right now. Parents are losing jobs. We don't have school. We don't have safe places for kids to be. And so what we really need are some of the things we always need. We still need mentors. We still need safe places for kids to be. Our families need food. Kids are needing emergency housing, and that's becoming difficult because a lot of providers won't take kids in off the streets because of COVID-19. So we've really had to work with providers around that. It's housing, it's food, it's resources, it's sustainable work, it's technology in order to stay in touch, like you said, and transportation to get to where people need to be. And I wish, some of the things that I wish we had more organized and sort of in place, those safety net things are things that I wish that were sort of more broadly established before this COVID-19 crisis, because we are certainly seeing our families and our kids struggle.
Safety net, always a really important part of supporting families and kids in their communities. We're getting to the end of the time that we set aside for this kind of panel discussion, because we want to make sure that we take some questions from our participants. So I'm going to ask you all each just one more question and see if you have a brief answer for it. Both of you have put significant changes in place, and the question is, what would you like to be able to keep past the time of coronavirus, and why? And we'll start with you, Judge Teske.
Yeah, quite frankly, about the third week into this, I met with my court administrator and my chief of staff, and I posed the question to them that I wanted them to take a look at the things that we've put in place and consider that while we walked into this thinking that what we're doing is temporary, what about these things that have proven to have good outcomes should become the new norm? And so specifically, on this whole issue, when we released 12 kids within 24 hours on the new admissions criteria, and by the way, I just want you to know that we have not had one single disruption or reoffending regarding any of these kids that we've released, including the ones that we subsequently released that was on a violent offense, okay, but had no previous history. None of them have disrupted. So it begs the question, okay, is there another alternative without using detention? Tying this back into, Dana, your opening comment that, we know the research is adamant of the harmful effects of detention. Once you detain a kid, you're already doubling the odds that they're not going to graduate from high school. And we all know where not graduating from high school can take you, okay? So with that said, they have returned to me and said, that's one of the things that on the felony nonviolent offenses, instead of detaining them, is having them come in the next day to intake, okay, which is what we're doing now. So we're not admitting them, but I don't want y'all to think we're not doing anything. We are doing something, okay? We are having virtual meetings the next day with the parents and the kids and assessing if there's an alternative to detention, like, for example, a GPS monitor. Or we have a partnership with the sheriff's office who goes out and randomly, every day, checks on them. We have what's called the HITS program. We have a number of things that we can put in place that's an alternative to detention. But do we have to detain the kid on some offenses to get that alternative to detention? And we're finding out the answer is no. So before we started our detention reform in 2003, our average daily detention population in 2002 was 62 in a 60-bed facility, some days reaching over 100 kids where we had to bring out the mattresses and have them sleep on the floor. Today, as I said earlier, the average daily detention population is 15. I believe we can still cut that at least in half. And the community be safe, by the way.
So using alternatives more creatively, moving straight to alternatives without detaining kids first, it sounds like are two major changes that you think may be sustainable beyond all the many changes you've already made.
Yeah, and Dana, one other thing that it's very extremely important that legislators and policymakers know. Since instituting this detention reform, which, you know, people, I understand, can be critical and say it's soft on crime, but understand that our juvenile crime rate, our filings are down 82%, our felony filings are down 64%. So it is not true, okay, that what we're doing is going to create havoc. The opposite. In fact, juvenile arrests in the state of Georgia since 2008 are down 60%. And since we instituted our reforms in 2014 that implemented the things that we did in Clayton County, the crime rates continue to fall. The opposite did not happen, and that's important to know.
Absolutely. Director Mueller, same question for you. What will you keep?
Well, I think, you know, like Judge Teske said, I have to echo and say that, you know, even in the face of expedited releases and the work we've done to sort of manage our population, we are not seeing any increase in recidivism. I can't say that we have none, but, you know, our average, we are actually seeing less than our sort of average rate of recidivism among the kids that have been released. I similarly, I don't see how we go forward in Illinois or in any state and sort of with business as usual in terms of the number of kids that we detain on the front end and the way that we keep kids in custody on the back end. I don't see how we, you know, stare down, you know, possible resurgence of this virus and other global health pandemics, and we don't take those lessons and truly understand that, I'm sorry, congregate care creates a huge public safety risk, and not just for the kids and folks who are held in congregate care settings, but for all the staff who work in them and the communities where those congregate care settings exist, and the communities where the staff who work there return to. So I would like to see us continuing to really think through critically how we utilize secure custody and what we can do as an alternative. The other things that I hope that we continue are sort of the focus on innovation and all the use of technology. We've been able to use technology really effectively, not just for supervision and support of youth, but we've seen this huge kind of blossoming of our training department using webinars, WebEx, and technology. So I'm hopeful that that continues. And I want to keep this sense of sort of teamwork and community that we're experiencing within all of our facilities throughout the department. I'm hopeful that that is something that we can continue to foster in a post-COVID universe.
Excellent thoughts. So just many of these questions we've talked about earlier, so I'm not going to belabor them, but some suggestions for areas that state leaders may want to inquire about, things like opportunities to reduce barriers to release, what we do inside facilities, what the previous slide, which you can look at, and there's a great resource from the National Juvenile Defender Center about, is how do we make sure that we're protecting the rights of kids when we're using all of this remote technology. So there are a number of things that have come up on this call that we encourage you to think about as you go back to your jurisdictions and back into session. Next slide. We just want to make sure that you're thinking also about federal funding opportunities. So we've talked about supports for for reentry and aftercare. And there are some deadlines coming soon that are particular to the Runaway and Homeless Youth Act. And there are 2 different funding streams that can be used to support kids in their communities that are relevant in this case. And so encourage you to ask whether people are taking full advantage and applying for those. There's also part of the coronavirus stimulus package that has opportunities for states and localities to use in correctional settings, and you can think about creative uses of those to get to some of the issues we've raised today. And one thing also that we've been hearing about that we want to make sure people understand, there's a possibility that states that don't fill all of the seats on their state advisory groups that guide Juvenile Justice and Delinquency Prevention Act funds may not receive those funds. We are hearing that that may be a position that OJJDB takes next year. I don't have that confirmed, but I think it's important to keep in mind that while people are busy with other things, that the slots on those state advisory groups should be filled, and you don't want to put your funding at risk. So on the next slide, we just wanted to remind you about a couple of other resources. NCSL has a terrific publication they put together on the principles of effective juvenile justice policy. There are a number of other resources from Pew. We want you to know that we're here to help. Anne is always a resource. If you have particular policy issues you'd like to discuss with us, we're also happy to help at Pew, and have a number of staff who've worked closely with states on reforms and are happy to talk with you, especially as you return to tough budget times. Some of the questions about how to allocate resources effectively are things that we'd encourage you to think about, and think about the research that underlies what's effective use of juvenile justice dollars. So with the last couple of minutes, we want to take questions that have come from the audience. And Anne, are you going to pull those?
Yep, I sure am. So I wanted to get to one quickly that I think we can answer is, where can we find the Mississippi response, and is it publicly released? And Dana, I think that we discussed a couple weeks ago.
Yeah, it's actually information that I have had from a conversation with the director of the agency who just retired. And I think it's documented in the Pew web analysis, and that may be the only place. But it's been confirmed to me in writing.
Great. I know there were some questions about some resources, and people would love some guidance on where to look for statistics on racial disparities with regard to discretion, release, isolation during the pandemic. Those numbers might not be readily available, but Dana, what do you suggest as places that might be good to go?
I think people should be asking their local jurisdictions. So we see some numbers, for example, I'm not sure if they're particular to race, but the California system has information available, and we'll make sure to get that link out. The Department of Public Safety has been publishing coronavirus-related data. And those are important questions to ask your local jurisdictions and your states if they're not publicly available.
May I share something too? I know that the Annie E. Casey Foundation's JDAI has been collecting data during this period of time as well. I've been a JDAI site with Annie Casey since 2003, so I've seen that data. And Annie, and with the JDAI, it's really big on racial disparities. So if you go to aecf.org and then click on the JDAI, and you should be able to navigate and find that data that they've been collecting.
Great, and we have one other question for you, Judge Teske. How has your practice influenced surrounding counties like DeKalb and Fulton?
Well, you know, that's a good question. You know, up until the juvenile justice reforms were implemented in that began January 1st, 2014, our influence out of Clayton County was limited. Okay, you know, it's kind of like that not to proselytize, but the Nazareth syndrome, okay, where, no one in Jesus's hometown would listen to his teachings until he left, okay? And so, but it's interesting because I was an integral part. Governor Deal brought me in and sent from 2012 until it ended in 2018. I was played an integral role in the recommendations that now what we did in Clayton County from 2003 up to that time, pretty much all of them, okay, were codified in state law now. At first, there was some disgruntlement, okay, but I can tell you now that as of today, my fellow judges are very pleased because they're getting money. They're getting incentive grant money as a result of reducing the bed space. Those monies are being captured in a reinvestment program. And my county gets, $750,000 a year to go to evidence-based programs. And I've had juvenile court judges call me and tell me what a difference it's made, because before they were complaining, well, we were just committing kids, to the state because we didn't have any local programs. Well, now they get the local programs, One other thing in closing, legislatively speaking, okay, I was testifying before Congress in 2014. Buddy Carter, who's a former state representative, during the time that we passed the major reforms, he was on that committee in Congress. And when it came to the Q&A time, he didn't really ask a question, but he wanted his fellow congressmen and women to know this, that he was in the state legislature when this went through, and we were still recovering, from the 2008 financial crisis. And he said, if it were not for what we did in reforming juvenile justice, I don't know how we would have made it through. We were able to save money, okay, that not only went to juvenile justice to improve it, but also went to infrastructure that we needed sorely. So just want to think about that.
Thank you, Judge Teske. Unfortunately, we are running a little bit short on time, so I would like to thank Dana, the judge, and Heidi for all of their comments. As a reminder, the PowerPoint and resources will be available on our website in the links that you've seen in the chat box, and we will be adding to the page additional resources that were mentioned and the recording for today. We'll also send a blast email out to all the registered participants with more information. So if we didn't get a chance to answer your question, please get in touch with us. And I'd really like to thank again the Pew Charitable Trusts for helping us design and produce today's event. And we hope to see you next week, where we will be covering federal justice and Homeland Security Agency responses to COVID-19. And the last virtual meeting in this series takes place on the 27th. That meeting, COVID-19 Justice Responses for Community Supervision, will feature Kathy Waters, Division Director of the Adult Probation Services Division in Arizona, and Kelly Mitchell, Executive Director of the Robina Institute of Criminal Law and Criminal Justice, and the Chair of the Minnesota Sentencing Guidelines Commission. So until then, please stay safe, happy, healthy, and sane as we get through these extraordinary times. Thank you so much.
Thank you.